Welcome everyone, Dr. Mike here again for another video with you. Today we're going to just talk about optometrists and what they do on a daily basis. As always, please do hit that subscribe button if you like eye-related material, whether it's funny or informative, whether you work in the industry or you just like the eyes and think it's kind of cool. There'll be something for you on this channel, so please do subscribe. So what does an optometrist do? Now, one of the most common misconceptions is all eye doctors do is check glasses, use that machine right there. Is one or two better? I know all the jokes, but at the end of the day, that's a very, very big misconception about optometry. So to give you an example, today we're at the end of the clinic day. I've seen about 14 people today, and I would say about 50% of them had either an ocular condition that is an ongoing problem that we're seeing or an acute problem that we're treating, whether that's a scratch in the eye, whether that's getting a foreign body or a piece of metal or something in the eyes that we removed, whether they have an infection. There is so much to optometry that a lot of people don't actually know, and that's partially why I started this YouTube channel, and I also have TikTok videos that I've posted. It's to give a little bit more insight as to what an optometrist does, because it's not just this machine, okay? Now, let's talk about some of the stuff that we do. So when you come in for an eye exam, as all doctors do, we're going to take a history, understand if there is any systemic conditions that's going on, because there's a lot that can cause problems in the eyes that is stemming from the body itself. So for example, diabetic retinopathy, that's something we see in the eyes every single day. Some people say, you know, I'm on diabetic medications, it's very controlled, and all of a sudden we look inside your eye and see there's vision-threatening problems because of the diabetes. Other things, high blood pressure can cause that. Any inflammatory conditions in the body can end up in the eyes, whether you're having stomach issues or gastrointestinal issues. Things like gout in your legs can cause inflammation in the eyes. There is so much more to just the one or two with this machine here that people don't actually understand and they almost take for granted at a certain point. I understand for the most part people think they go to the family doctor to get everything checked, but the family doctors are just doing a quick brief exam, and most family doctors will actually recommend you to have your yearly eye exam to rule out any problems or any conditions that they otherwise wouldn't find from blood testing or general systemic testing. Now, what machines do we use? So this is a common question I get. Obviously, a lot of people know about this machine. This is used to test the eyes and test if you need glasses, yes, but that's not all it's used for. We even use this machine for binocular vision disorders. If people are having double vision, we're able to test with this machine here. For example, kids that otherwise won't give you a response, we have this little machine right here, which is called a retinoscope. Okay, and we're able to use this in concurrent with this machine right here and get a prescription for somebody. Or let's say they're not able to communicate. We're able to use this and that and get you a prescription, okay? Now, what other machines do we use? This one right here is probably one of the most important machines in our office. It's called a slit lamp. What that allows us to do is examine the front portion of the eye, the inner ocular structures, and in the back of the eye as well. So we have these different set of lenses right here, as you can see, and depending on the lens, we're able to use it with this machine and check the inside of the eyes as well. Now, what this machine generally helps us see are those ocular conditions that otherwise wouldn't be found if all we were doing was checking which is better, one or two. Throughout a day, when somebody comes in, the first thing that we do is check the history of the patient, get a full understanding of why they're here, what problems they're having. That kind of creates a patient plan in our head as the doctor, because let's say somebody's saying, you know, I'm having blurry vision. That blurry vision for a 20-year-old might be different than blurry vision for a 40-year-old or a 60-year-old or a 90-year-old. So we're making almost a plan as we're talking to you and hearing about the problems that you're having with your eyes, okay? So that's number one. Number two, we begin checking your vision, because the vision is probably the most important part to give us a clue as to what's going on. For example, if your vision without glasses is not 20/20, but then you put on the glasses and we check and it's 20/20, we do have a few check marks in our heads that say, okay, this problem, and that problem can't be existing in this patient, okay? So a great example is a 50 or 60-year-old comes into the office, they're having some blurry vision, they think all it is checking for glasses. We check their vision with their current glasses, doesn't improve their vision. We check their vision with this machine after we refine a new prescription, and vision doesn't get better. What are we thinking now? Something inside the eye is changing, whether that's cataracts, whether that's some type of systemic condition that's ending up in the eyes, such as diabetes, high blood pressure. There's a whole host of things. So it's not just this machine. I can't stress that enough. Now, with this slit lamp right here, we're able to examine the basic structures of the eyes. We're able to examine the eyelids. We're able to examine the front part of the eye, the inner structures of the eyes, as well as the back of the eye. Okay, so this machine here helps a lot to actually get down to the bottom of, is there a problem with the eye? Is there a condition that's occurring? And how do we fix that? So, for example, if somebody comes in with a scratch on the front part of the eye, we'll use this machine in addition to some drops to be able to look at the front surface, be able to tell where the scratch is, how deep it is, and what we need to do from there to help. Okay, so these two machines do make up a big part of the eye exam. We also have this machine right up here. It's called the BIO, okay, binocular indirect ophthalmoscopy or ophthalmoscope. We use this to examine the far periphery of your retina. So if you've ever had an eye exam, you probably know your eye doctor will put those drops in your eyes. This allows your eye doctor to be able to take a better look in the back of your eye. So a lot of people will come in without any problems. All they feel they need is glasses. We check the glasses, vision is back to 20/20, but your eye doctor is not done yet. They offer to do those drops. They take a look inside the eyes because there could be silent things going on and changing inside your eyes that will allow us to fully check and get to the bottom of it, essentially, and make sure there's no conditions that are causing any other problems. There are other machines that we use. There's imaging, such as an OCT or a fundus photo camera that we use. This allows us to monitor your eyes not only in the examination that you had, but in future examinations. So we are as good as humans can be. We will write down as much as we can. We write down measurements of the eyes, but a picture says 1,000 words. You have that picture that is documented. The next exam that you come, we're able to pull it up on our screens, look at your eyes, and double check and make sure everything's all right. So as you can see, there's a lot more that meets the eye than to what your eye doctors are doing. At the end of the day, your eye doctors are doing as much as they can to keep the health of your eyes good. But the idea that we're just here for glasses and that's it is a total misconception. I would love and I will show you a day in the life of an optometrist, so stay tuned for that. Please do check out some of my short videos because you'll see there that there is so much that we take care of, whether it's front part of the eye, whether it's back part of the eye, whether it's just glasses, binocular vision problems. There is a whole host of things that we do on a daily basis. And I promise your eye doctor is thinking the whole time. They're not just talking to you to talk to you, okay? Don't get me wrong, we love talking to you, but we also are kind of fishing for more answers. If we don't know what's going on, we start talking to you about it, and we consult with appropriate people that can help us figure out what's going on. A great example of this, a patient the other day came in with what we call a uveitis. It's the inflammation of the eye. In their case, it was the front part of their eye, and that requires blood testing. That requires further tests to figure out why did it happen. Your eye doctor can treat that and we can make it go away, but the question isn't can we fix it? The question is why did it show up? And that's where we consult with your family physicians. That's also where we consult potentially with ophthalmologists who are surgeons or more specialists of the eyes. That's where we'll also consult with potential neurologists and other doctors in different fields to be able to get down to the bottom of it, okay? There is so much more than just one or two. So I hope that gives you a little bit more insight into what an optometrist does. Again, as I always mention, you only have two eyes. Take care of them. Thank you again for watching. As always, if you do like the content, if I gave you little tidbits of information that was helpful, please do hit that thumbs up button, that like button, and also hit that subscribe button. Thank you again for joining, and I'll see you in the next videos.